Hey guys, Dr. Cycle, UroCoach. Painful bladder syndrome is ruling your life. Let's talk about 3 medications that can help fix the problem and 1 non-medication at the end that'll fix it. Stay tuned. Hey guys, Dr. Cycle, UroCoach. So in this video, I'm going to tell you 3 medications that can fix painful bladder syndrome. And at the end, make sure you stay tuned for our pearl of wisdom on a non-medication that can fix it. But first, please like, subscribe, please comment below. We want to hear what you all want to hear us talk about. Yeah, so let's get into it. The first medication I want to talk about is Uqora, Uqora. You've probably seen this on TV. You've probably seen it during football games, on Amazon, etc. What is it? So it's primarily marketed for individuals with frequent urinary tract infection. However, there's a number of components in Uqora that can help with painful bladder syndrome. For instance, it has potassium citrate in it, which is an alkalinizing agent, okay? So acidic urine irritates the lining of the bladder. So anything that can alkalinize the urine has the ability to help with painful bladder syndrome. It also has D-mannose in it. What is D-mannose? D-mannose is primarily used as a separate supplement to decrease your incidence or chance of getting urinary tract infections. But what it does in individuals with painful bladder syndrome is if there's a low level amount of bacteria in your bladder that's adherent or stuck to the lining of the bladder, and that's causing you to have perpetual discomfort in the bladder, then D-mannose, that component of it, can make it so that bacteria is less likely to stick to the lining of the bladder. And if that's the precipitating factor for your painful bladder syndrome, specifically a small amount of bacteria, then it can decrease your chance of having painful bladder syndrome for that reason. Citric acid is in Uqora as well. Citric acid, it is an acid, but it's a weak acid. So the idea is that if you have very acidic urine, if you added a weak acid, it will increase the pH of your urine. In other words, make it relatively less acidic. It's also got vitamin B6, vitamin C, magnesium. I don't know if these things help or not, but they're in it, so I just wanted to tell you that. One question I have, and I don't know the answer to this, is these components that are in Uqora, how much do they actually increase the pH? I don't have that data. And one other thing about Uqora is it can be somewhat pricey, right? So it costs like 25 bucks for 10 packets, and 1 dose is 1 packet. So $1.50 per packet. Having said that, if it helps you, maybe it's worth it. Okay, the next one I want to talk about is Hyocyamine, okay? It's also known as Levsin, which is the trade name. Now, the first thing I want you to know about it, this is a prescription medication. You need a doctor or urologist, a PCP, to write you for this medication, okay? It works as kind of like a bladder relaxant. It's almost like, I would describe it like it's a massage for your bladder. So the way this drug class works, so this is in a drug class called anticholinergic medications. These types of drugs make it so that your bladder is less likely to contract. If you're having painful bladder syndrome because your bladder contracts too much, we oftentimes call this a bladder spasm, the medications like Hyocyamine can work. Now, one of the things I like about it compared to other anticholinergic medications like ditropan, like Detrol, like Vesicare, is that it has a relatively short half-life, right? So it's quick on, quick off. If you are having acute symptoms, you can take it and it can help with those symptoms, and then it should be out of your system relatively quick compared to some of its counterparts. 2.5 to 3 hours is the half-life, and you can dose it every 4 hours. Some of the side effects, and this is one of the downsides of Hyocyamine: number 1, constipation; number 2, dry mouth. Having said that, if those things don't bother you relative to the painful bladder syndrome, then it may be worth doing for you. And the last one is kind of taken in a different way. It's called Prelief, okay? You take this actually when you are going to have a bladder irritant. So if you know something bothers your bladder, and we'll talk about those in a second, then you take this medication with it to decrease the chance that you'll have one of these painful bladder episodes. It's got an active ingredient in it called calcium glycerophosphate. This is an alkalinizing agent. So again, if you have acidic urine, then it'll neutralize it and make it less likely to irritate the lining of the bladder. If you go on their website, they have a cool video where they show a cup of coffee, which is known to be acidic, and then they take the pH of it. The pH is low, and they put a packet of Prelief in there. they take a pH reading of it and the pH increases, so it does seem to work in this regard. One of the reasons I like it is that it's taken in a different way than some of the other ones. The other ones are reactionary. This is prophylactic. It is also relatively inexpensive. I think it's like 27 bucks for 300 pills, so it's more cost effective. But this brings me to my pearl of wisdom, okay? So the most effective thing oftentimes for people is doing a rational elimination diet. The most common bladder irritants are spicy foods, acidic foods, caffeine, smoking, alcohol, artificial sweeteners, high sugar foods. And if you look at the video above that we did that talks about irritants of the bladder that cause you to go a lot of these are bladder irritants. And if you do a rational elimination diet where you list these foods or list these irritants and then take them away one at a time, oftentimes you can hit on the one that is most insulting to your bladder. Potentially, if you want to cheat on that food, you can take it with a medication like Prelief. I like an elimination diet because it doesn't involve a medication, right? It's a natural thing to do. And there's a rational way to do it so you don't have to take out everything that you love. Just check out that video that I just mentioned a few minutes ago. Anyway, I hope those things are helpful to you all. Painful bladder syndrome is very annoying for people. It's difficult for us to treat, but these tips I hope are useful to you. Please like, subscribe, please comment, tell us what you want to see. We want to know that information. Have a great day, guys.